This is your daily Facts Matter update, and I'm your host, Roman, from the Epoch Times. And now let's begin today's discussion by talking about the CDC. 3 days ago, the CDC released a new statement in which they signaled that a change is coming to their COVID vaccine schedule in order to mitigate the number of people who are experiencing heart inflammation after getting the COVID shots. Specifically, the CDC told its vaccine advisory panel two different things. The first thing was that they are planning to adjust their vaccine guidance for people with weak immune systems, meaning that at this very moment, as it stands now, if you are an individual with a compromised immune system, the CDC advises that you get 4 doses of either the Moderna or the Pfizer vaccine. And according to their current guidance, which you can find over on the CDC website, you're advised to get 3 doses of the vaccine within 2 months, and then a subsequent 4th dose at least 5 months after the 3rd dose. However, the revised schedule that they are about to implement, it recommends that immunocompromised individuals should instead get that 4th dose of the vaccine as soon as 3 months after the 3rd one, meaning that they are bumping up the schedule for the 4th shot by about 2 months. Now, that is, of course, if they took the mRNA vaccines. If these individuals instead took the Johnson & Johnson approach, well, then the updated CDC guidance says that they should get the 1st dose, then at least 28 days later get a 2nd dose, and then as soon as 2 months later get a 3rd dose. Now, the rationale behind this change, it was explained by Ms. Alicia Hall, who is a health education specialist over at the CDC. And the way that she explained it was by citing several small studies which indicated that immunocompromised individuals are better protected if they get the 4th shot sooner. Here's specifically what she told the vaccine advisory panel during a conference call which took place last Friday. Quote, "The goal is to help this population that may not be as well protected get their booster dose sooner, particularly with concerns about initial immune response, loss of protection over time, and high community transmission due to the Omicron variant." Now, in that statement, she of course referenced the Omicron variant. And if you've been following the general COVID developments over the last, let's say, month or so, then you likely know that while the vaccines were already beginning to wane in the level of protection that they offer against the Delta variant, it's become ever more evident that their performance has become even worse against the Omicron variant. In fact, one of the members of the CDC panel, Dr. Camille Cotton, she's an infectious disease expert over at Massachusetts General Hospital, and during the conference call, she said that she has seen, quote, "many immunocompromised patients in the past 2 months who followed all the rules, including the recommended vaccination schedule, but still became infected with the virus." She then added that this new updated guidance will, quote, "help dramatically." Okay, so everything that we've been discussing thus far is about immunocompromised individuals. However, during that CDC conference call, the agency also hinted at a likely change that will apply to the general population as well. And that change has to do with the length of time between the 1st and 2nd dose of the mRNA vaccines. So, as you're likely aware, both the Pfizer and the Moderna shots, which are both based on mRNA technology, they both require 2 doses in order for the recipient to be considered fully vaccinated. And as it currently stands, the CDC recommends that for the Pfizer vaccine, a person should wait 21 days between the 1st and 2nd shots, while for the Moderna vaccine, a person is recommended to wait 28 days between the 1st and 2nd doses. However, according to surveillance data, it shows that among many age groups, but particularly among young males, there has been a much higher than expected rate of heart inflammation for people who get the mRNA vaccine. As just an example, according to the CDC's official data that you can find over on their website, it shows that when you're looking at males between the ages of 18 to 24, for those who got 1 dose of the Moderna vaccine, there were about 10.7 cases of myocarditis per million. And then for those who received 2 doses, there were 56 cases of myocarditis per million. Although frankly, as we have already discussed in a previous episode, it's unclear whether that is the true number, because there was some data over on the FDA's website, which was later deleted after we asked them about it, and that data showed that the rate of myocarditis in young men following a 2-dose regimen of the Moderna vaccine was actually 148 cases per million, or about 2.6 times what the CDC was saying on their website. But regardless of what the actual number is, if we're just going to go by the CDC's own data that's over on their website, it's clear that the incidence of myocarditis increases by over 500% when you go from the 1st shot to the 2nd shot. And it appears that the CDC is in fact acknowledging this reality, and they will start to separate the doses from each other. The reason that they are citing for this kind of a change is that according to data from both Canada as well as England, both of these countries, they extended the interval between the 1st and 2nd doses, and their results, they suggest that an extended time period lowers the rate of both myocarditis as well as pericarditis. Both are types of heart inflammation. Here's specifically what a representative from Canada's Public Health Agency said in the statement. The longer interval resulted in lower myocarditis rates, whereas the shorter interval had higher myocarditis and pericarditis rates. And then likewise, Dr. Grace Lee, who is the chairwoman of the CDC's advisory panel, as well as a medical officer at a children's hospital, she said that the data that's coming from Canada as well as England is, quote, convincing that an extended interval is not only potentially safer from a myocarditis standpoint, but also potentially more effective. Now, it is worth noting that some countries, after seeing the heart inflammation data, they have either stopped or slowed down their use of the mRNA vaccines, particularly the Moderna vaccine, among young people. In fact, several months ago, there were 4 Nordic countries, specifically Finland, Norway, Sweden, and Iceland, which suspended the use of the Moderna vaccine for younger people altogether due to their heightened risk of myocarditis. However, as we're seeing, American regulators are taking a different approach, and they are continuing to recommend the shots to all Americans above the age of 5. Their argument, meaning the American regulators' argument, is that the vaccines prevent more hospitalizations than the heart inflammation cases that they cause. But they can't ignore the fact that they do cause cases of heart inflammation, which is why they are now taking this approach of widening the intervals between the first and second doses. And so, after analyzing the data which came from the countries which have these different vaccine schedules, the CDC panel then endorsed this interval of about 8 full weeks between the first and second dose of an mRNA vaccine, meaning that the recommendation would go from being around 21 to 28 days between the 2 shots to about 56 days between the 2 shots. And in a post to Twitter, Dr. Walid Galand, who is a professor of medicine over at the University of Pittsburgh, he called this change of recommendation a big deal, but he added that it was, quote, troubling that it took so long for U.S. policymaking to catch up to other countries. On the flip side, however, members of the CDC panel, they said that they hoped that this new change will help to convince more unvaccinated individuals get the shot. Here's what one member of the panel said. I think that it affords a level of safety and also demonstrates to the public that we are very focused on doing this in the right way. Now, it is worth noting that while the CDC advisory panel has suggested making this change, the CDC agency itself has not yet decided whether they are going to be following this advice, and therefore, at this very moment at least, their guidance has not actually changed. Regardless, though, it is also worth noting that the 2 different recommendations that we've discussed seem to actually be contradictions to one another. Because on the one hand, this panel is suggesting that immunocompromised people should shorten the intervals between the 2 shots in order to make them more effective, but based on what they said later, that could potentially cause more cases of heart inflammation among people with weaker immune systems. But on the flip side, they're suggesting that the general population, they should actually space out their vaccine doses across more weeks so that these people don't get as many cases of heart inflammation. And when they were discussing the second point, the CDC advisory panel chairwoman, Dr. Grace Lee, she said this. The data coming from Canada and England is convincing that an extended interval is not only potentially safer from a myocarditis standpoint, but also potentially more effective. And so it really might be the case that there are different data sets for the general population versus the immunocompromised, but on the surface at least, it appears that they are shortening the interval for the immunocompromised in order to make the shots more effective, but also lengthening the dose intervals for everybody else to make them safer, but also potentially more effective. Now, we here at the Epoch Times, we did reach out to the CDC for comment, but they have yet to get back to us. Regardless, though, if you'd like to read the full story for yourself, or also if you'd like to watch the entire CDC advisory panel meeting, it's about 7 hours long. If you'd like to sit through it for yourself, I'll throw the links into the description box below this video for you to check out. And all I ask in return is that you take a super quick moment to smash that like button for the YouTube algorithm. And now, since we're discussing immunocompromised individuals, I think it's also worth noting that scientists have now discovered a new highly infectious mutant HIV strain over in the Netherlands. And we'll get into it right after a short word from our sponsor. That's right. Our sponsor for today's episode is a phenomenal organization that not only advocates for conservative values, but also provides awesome membership benefits to over 2 million people across the entire country. I am, of course, talking about AMAC, or the Association for Mature American Citizens. Now, they are quite literally one of the fastest growing conservative organizations in all of America, especially for those aged 50 and up. Although, frankly, you don't have to be over the age of 50 to join. You can be any age. And if you do join AMAC, you will get phenomenal benefits, such as money-saving benefits, access to cutting-edge news, and in fact, they will actually send you a bi-monthly magazine directly to your mailbox, which is quite honestly awesome. I love AMAC's magazine. However, besides all the money-saving benefits, a lot of people said that they joined AMAC because of the fact that they fight on Capitol Hill for conservative values. Here's in fact what they wrote. As a socialist storm is brewing, if you care about the future of America, like the 2 million members of AMAC, then you should join as well. And you can do so over at amac.us/factsmatter. That's amac.us/factsmatter. Go on there, join the organization. It doesn't cost that much. However, the membership benefits are great, and the cause is even greater. Again, that's amac.us/factsmatter. And now let's head back to the studio. And now let's move on over to the Netherlands. According to scientists who are working with Oxford University, they claim to have just discovered a new, highly transmissible and much more damaging strain of HIV over in the Netherlands. Now, these scientists, they're calling it the new virulent subtype B, or VB for short. And according to the findings that they published over in the Science Medical Journal, this international team of researchers, they identified 109 cases of this new variant after analyzing more than 6,700 samples of patients who had tested positive for HIV. And after doing further analysis, the researchers determined that this variant has been circulating in the Netherlands for at least several years. And what's interesting to note is that their research revealed significant genome differences between this new VB strain and other HIV variants. And one of those differences is that it contains a much higher viral load, meaning that this new strain of virus would be much more virulent and much more infectious. Here's specifically what they wrote in their post, quote, "Individuals with the VB variant had a viral load, the level of the virus in the blood, between 3.5 and 5.5 times higher. Furthermore, according to these researchers, the rate of CD4 cell decline, which is the hallmark of the damage to the immune system that's caused by HIV, quote, occurred twice as fast in individuals with the VB variant, placing them at risk of developing AIDS much more rapidly. But perhaps even more importantly, the researchers found that patients infected with this new VB strain, well, they also showed an increased risk of transmitting the virus to other people. Now, as bad as all of that is just by itself, it's also compounded by the fact that a new study out of South Africa, it found that a woman suffering from HIV, but also had COVID for the last 9 months, she saw the virus develop at least 21 mutations while in her body. Let me just repeat that. A South African woman suffering from what researchers called poorly controlled HIV, but who also had COVID for about 9 months, she had the virus develop at least 21 mutations while in her body. The researchers concluded that there needs to be increased vigilance among the HIV patients who also contract COVID in order to prevent the emergence of new variants. Here's specifically what the researchers over in South Africa wrote, quote, "This case, like others before, describes a potential pathway for the emergence of novel variants. Our experience reinforces previous reports that effective antiretroviral treatments is the key to controlling such events." Now, according to the observations of these researchers, they found that the virus of this patient, it had developed around 10 mutations on the spike protein, as well as another 11 mutations within the virus cell itself. Here's specifically what they added, quote, "Once again, our experience reinforces previous reports that effective antiretroviral drugs are the key to controlling such events. Once HIV replication is brought under control and immune reconstruction commences, rapid clearance of the COVID virus is achieved, probably even before full immune reconstruction occurs. This underscores the broader point that gaps in the HIV care cascade need to be closed, which will benefit other conditions and public health problems too, including COVID-19. However, it appears that Big Pharma is on the way to saving the day. That's because just a few days ago, it was announced that Moderna has begun the clinical trials for their mRNA-based HIV vaccine. That's right. About 10 days ago, Moderna launched their phase 1 clinical trial for their mRNA-based HIV vaccine. And they're doing this in partnership with another organization. It's a nonprofit called the International AIDS Vaccine Initiative. The abbreviation for that organization is IAVI. And according to the press release from the company, the way that this vaccine that they're testing works is very similar to the COVID vaccine, wherein they insert a piece of genetic material into the body and have the body's own immune system prime the B cells to fight back against all these different mutations of the HIV virus. Here is how the CEO of this organization, the IAVI, described these clinical trials, quote, "We are tremendously excited to be advancing this new direction in HIV vaccine design with Moderna's mRNA platform. The search for an HIV vaccine has been long and challenging, and having new tools in terms of immunogens and platforms could be the key to making rapid progress toward an urgently needed effective HIV vaccine." Now, the way that this vaccine is meant to work is that the researchers engineered an immunogen, which is a type of antigen which is supposed to elicit a response from the body's immune system. And so basically when you inject this immunogen into the body responds by creating these types of B cells that fight back. And this immunogen that they're injecting looks like the HIV virus. And so in theory, the theory here, at least the way it's supposed to work, is that you inject this immunogen into a person's body and they naturally produce the B cells to fight back. And because the immunogen looks like the HIV virus, the B cells that the body produces should also be able to fight the HIV virus, sort of like how the mRNA technology supposedly works, wherein they throw in this certain cell with a spike protein on it, and then the body's supposed to develop antibodies to fight against that specific spike protein. But the difference being that the HIV virus has a lot of different mutations, a lot of different variations. Even within one individual, the same HIV virus can have many different mutations. And so the types of B cells that an individual has to produce have to cover a very broad spectrum of spike proteins. Here is what the ultimate goal of this trial is, according to the researchers. Quote, "The ultimate goal is stimulating the development of B cells that can produce broadly neutralizing antibodies that can target a broad range of HIV variants." Now, one thing that's worth noting is that the margin of error for HIV is essentially less than for COVID, because with COVID, let's say you get the vaccine, the virus slips through the vaccine and you still get infected. Well, likely if you look at the odds, you will survive and you can move on. But with HIV, it's not the case, because once it gets into your body cells, well, it rapidly and wildly replicates itself and infects you for the rest of your life, which is exactly why Dr. Davy Smith, who's an infectious disease specialist over at the University of California, San Diego, here's what he said, quote, "If HIV gets through to start an infection, even if somebody has been vaccinated, then that infection is lifelong." Now, in terms of how this clinical trial is actually going to be conducted, the researchers found 56 healthy HIV-negative adult volunteers in order to enroll in this trial. And out of them, they will receive one of several different types of concoctions to see what kind of response it generates in the body. And then the researchers will follow the participants for 6 months to examine the immune responses and monitor for any potential safety concerns. Now, in terms of how they will measure the effectiveness of this vaccine, I imagine that they will be looking at the B cells to see what kind of variations that they generated, rather than injecting these people with HIV, because I couldn't imagine that would be the way that they would test it, because that seems very dangerous, although I did not see anything written about that in the clinical trial data. Now, the only other thing I think is worth mentioning, that part of this trial is being funded by the Bill and Melinda Gates Foundation. Thought that was rather interesting. And then we'll just have to see how it'll work. Probably in the next few days, rather in the next few weeks, once data begins to come in from this trial, I'll have more to report to you. Otherwise, we did reach out to Moderna for comment, but have yet to hear back. Otherwise, Roman in the studio, back to you. If you'd like to read more about this new strain of the HIV virus, which was found over in the Netherlands, the COVID mutations in South Africa, or about this new Moderna vaccine trial, I'll throw all those links into the description box below this video for you to check out. And all I ask in return is that if you haven't already, take a quick moment to smash that like button for the YouTube algorithm. And now, since you've completed this episode of Facts Matter, I would highly recommend that you head on over to Epoch TV and check out an awesome exclusive interview between President Trump and our own Kash Patel. Here's a trailer.
They're making us a different country. We're becoming like a socialist or a communist state. We no longer have a press. The press is absolutely the enemy of the people.
I know 3 years is a long time away.
It's a long time.
But if you were back in and, what was the first thing you'd say to say?
Oh, back in? If I were back in now? The wall. First of all, the wall.
You would tell the American people now.
The whole concept of children, with the children going through all of this, masks and vaccinated, what they're doing is just absolutely crazy. Why would they want to have a weak military? Why would they want to have high interest rates and higher taxes? And why would they want to have no border?
Where's John Durham? Do you have faith in it?
What he's doing is one of the most important jobs being done right now in America.
How do you give them a little faith?
Everything's fixable, but you need the right people to fix it.
If you'd like to check out that full interview, I'll throw a link to it. It'll be right there at the very top of the description box. And then until next time, I'm your host, Roman from the Epoch Times. Stay informed and stay free.